Okay, I'm Larry Wyatt. We live at Alamo, Kentucky, which is between near Murray State University. And my back started giving me problems in 1987. And I had first surgery was in 1987. It had to be redone again in April of 1991. And it was still giving me trouble. I contacted that particular doctor, and he said, I've done all I can do. And I could just barely walk. So I was talking to some friends, and he recommended a Dr. Davis here in Nashville. I came down to see him. He did a discogram. And he said, what you need, I'm getting ready to retire shortly, and I'm not doing that, but I've got a physician coming in from Johns Hopkins University. His name is Dr. David McCord. And he said, by the way, he's from Christian County, which is near Murray, where we live, so that made me feel a little better. So we came down and we had an examination, and he said it was going to be a while before all of his equipment could be set up for what he needed for this particular kind of surgery. And so we waited and we came, and I was on the call list. And he called, or maybe his nurse called, and she said, you know, we've got you scheduled for like Friday, but she said, nobody wants to be first in this particular surgery. And she said, do you mind? And I had been laying flat on my back for 30 days, and I said, I'll come tomorrow if you can help me, you know. So she set me up to surgery, so we came down. Surgery lasted 8.5 hours. And I was released from the hospital, I think, in about 4 days. And the last time I saw Dr. McCord was in 1993, I believe, and he released me. And I've started seeing a chiropractor in 1995, and she's kept me going. I have some occasional flare-ups, but I work in lending in a bank, and I've just missed very few days all that time. So I feel very fortunate that I had this type of surgery, and it's really helped. And things are going rather well now.
So you had the original cage surgery, is that right?
No, I didn't have cage surgery. He fused 4 and 5, and the base of my spine was actually narrowed, and he said that was from birth. See, my particular surgery, they went in and they fused L4 and L5. But in addition to that, I had a narrowing of my spinal cord near the base, which Dr. McCord said that was from birth. And they actually had to move nerves over and actually go in the spinal cord canal, clean it out, and actually give me more room for my nerves to operate. And he said, you know, I was destined to have this trouble because of that narrowing from the space. And my previous doctors had mentioned that, but they didn't want to tackle that problem. And so he said he had some nerve monitoring equipment and things, and it was a new procedure, and it went well. So I've been up and going, and 7 grandchildren, and life is good. Feel very fortunate. When I first met Dr. McCord and he examined me and looked at my records, the MRIs and previous surgeries and things, he was pretty emphatic about it. He said, you know, I think I can help you. I think I can get you going. I've done this type of surgery at other locations. And I felt confident in him because he appeared to know what he was doing. He seemed to care about people. My schedule was handled properly, and follow-up visits were monitored, and everything I thought went rather well for the whole duration. And so I really appreciate what he did and that he's kept me going, because at one time it was pretty scary when one doctor says, I've done all for you that I can do, and you're laying flat on your back and you can't hardly get up and walk around the house.